When COVID-19 arrived in the United States, little was known about this novel coronavirus. But one thing was clear: few were prepared for what was to come. Meanwhile, in Chicago, where the virus was just a few short weeks from arriving, Rush University Medical Center was preparing for the worst and hoping for the best.
Tonight, the U.S. Department of Health and Human Services estimates that if the coronavirus outbreak becomes very severe, about 38 million Americans will need medical care.
If our numbers continue to increase and we don't contain, and as a society we don't mitigate the course of this spread, then we won't have enough beds.
The virus can only travel about 3 to 4 feet. And so by staying 6 feet away from people, you reduce the risk that you could acquire the infection.
We also have the ability to double up on beds, which would pretty much double our capacity to take care of patients with coronavirus.
At the end of the day, no one will critique us as a nation if we over-prepare.
And as Americans look to infectious disease experts, Rush leaned into its mission of health education to sound the alarm.
Scrub them all together. Scrub them all together.
You do want to give your kids information, and you want to do it in a very calm way.
Social distancing actually works, and it is our best defense right now against this rising epidemic in our country.
Despite the warning signs and calls to action, the virus still threatened to overwhelm the city of Chicago's hospitals. By the second week of March, it was clear that Chicago's hospitals were about to face a first surge of patients. But Rush University Medical Center was uniquely positioned to lead through the pandemic.
Simple protocols like these are just the beginning of what this hospital has done to handle COVID-19. You're looking at a 14-story facility specifically outfitted for a pandemic years before it ever hit.
Thanks to the foresight of Rush leadership, many of the challenges that hindered the coronavirus response across the country never materialized.
Our ICU here is a well-oiled machine. We're used to seeing high acuity, very sick people.
He's a young gentleman whose wife is at home with a toddler and she can't even be here with him.
Brady treats critical COVID-19 patients that need ventilators to stay alive.
This is not made up. We're very busy. These patients are very sick.
Preparation and thought leadership put Rush on the national stage, with experts across multiple disciplines lending their voice to the fight against COVID-19 and consequently reassuring a distressed public.
You had to come up with real hardcore critical thinking and innovation. God, it showed a lot of strength, and when it got tough, we got tougher.
Sequence for donning PPE, putting on your capper belt isolation gown, followed by your capper respirator, your gloves.
We are at 20% above the national average in saving patients with VV ECMO, which is a specialized form of ECMO for supporting the lungs.
We were at Rush University Medical Center when the 5th Illinois coronavirus case was confirmed.
To keep our staff safe, to keep our patients safe as well. So that
Dr. Paul Casey treated him. That's Dr. Casey on the left in the coronavirus patient's room. He used a tablet to conference in an infectious disease expert.
As the surge sustained from days into weeks and months, the city's most vulnerable populations found themselves suffering the hardest impact of the virus. And Rush, bolstered by its anchor mission and commitment to bettering the west side of Chicago, went to work.
There needs to be a strategic effort to reach out and address health disparities in the country.
We were getting calls from family members who had just dropped off their loved ones in the ER and had no idea what was happening to the family member. They knew that they didn't speak English, and so then just added the stress.
We didn't hit that point where there was really a free sharing of information around what the beds and capacities were throughout the city, so that we could be sure that if a patient was sitting at Jackson Park Hospital, that they had equal opportunity to get to whatever hospital, would be able to take care of them.
Rush University Medical Center will split $5 million from Winfrey's Foundation.
Look for organizations that we're going to have their hands directly in the community.
In many ways, the fight against COVID-19 embodied Rush's commitment to the health and well-being of Chicago.
There are hospitals like Rush, just as one example, that have really converted their entire hospital into a COVID-19 hospital. They got ready for an onslaught.
In mid-May, the state of Illinois lifted its moratorium on elective surgeries, and Rush began to welcome patients back. This time with a new message: don't delay your care. Rush is here for you.
It's by the grace of God that I'm actually here today, because I shouldn't be.
If I had waited any longer, I would not be here.
I know that my safety is their number one concern, and so it doesn't have to be my concern.
Phase 3 trials of the new AstraZeneca COVID-19 vaccine could begin in Chicago in the coming days. And now Rush University Medicine, Cook County Hospital, and Northwestern Medicine are all looking for a diverse group of volunteers.
There is a signal that it can work.
COVID-19 is still very real, but the impact of Rush University Medical Center also remains, with calm and preparedness that is felt throughout the hospital as patients and families embrace an unknown future, but with confidence that Rush is here providing a national model for safe, quality care.
I'm seeing them recover on ventilation, on just almost near death, and they're walking out of here. That gives me so much hope.
Just want to say thank you.